Erin is a fellow female patient who is 62 years old and presented to our osteopathy clinic with lower back complaints. Erin seemed to look more run down than a lower back complaint would cause. Upon further questioning and system screen, she revealed vague and non-specific symptoms such as abdominal pain, bloating and constipation, pressure on her bladder, increased menstrual bleeding, sudden shortness of breath, lethargy, early satiety, unexpected weight loss, and finally increased urinary frequencies. Unfortunately, Erin did not respond to any treatments, and due to the suspicious and unusual symptoms reported, the osteopath considered Erin's family history of both paternal and maternal existing ovarian and breast cancers. It was then decided to best immediately refer Erin back to her general practitioner for further evaluation. Unfortunately, Erin has been suspected with ovarian cancer, and we received information that Erin is undergoing diagnostic measures to determine which cancer stage and management involved.
Erin was referred for further diagnostic testing. This includes transvaginal ultrasonography and tests for cancer antigen 125. Complete blood count, liver function, and calcium levels are also tested to assess paraneoplastic syndromes. A rectovaginal exam will be performed by a gynecologist. If abnormal or suspicious cells are found, the patient is referred to gynecologic oncology for evaluation and diagnosis, staging, or risk-reducing surgery.
So what exactly is ovarian cancer? Ovarian cancer is the 8th most common cancer affecting women in Australia today. Ovarian cancer is a general term to describe a malignant tumour affecting either one or both of the ovaries. The ovaries are a pair of small organs in the female reproductive system which produce eggs. This cancer can affect either the epithelial, stromal, or germ cells of the ovaries. If we have a closer look at an ovary here, we can see that it's made up of epithelial, germ, and stromal cells. 90% of cancer exists in the epithelial layer and only 5% can affect stromal or germ cells. In fact, most epithelial tumors are benign in nature, and only 70% of females with epithelial ovarian cancer become at risk of advanced stages. This is due to late diagnosis or unclear appearance under the microscope. These cases are known as borderline tumors or low malignant potential at the time. Some factors increase the risk of ovarian cancer. These include females over the age of 50, existing family history from both sides, changes in genes BRCA1 and BRCA2, infertility, early onset of periods, or late menopause. If we dive into pathophysiology of cancer, it begins by differentiation of cells that overlay the ovaries. These cells proliferate during ovulation and incorporate themselves into the ovaries. However, current evidence suggests that tumors may originate in the fringe tissues of the fallopian tube. So how exactly can ovarian cancer metastasize? Answer is, cells that overlay the ovaries differentiate and intraperitoneal spread takes place through fluid circulation. This is classified as stage 3 and 4 cancer. Metastasis can occur to the liver, the fluid around the lungs, the spleen, the intestines, the brain, and skin or lymph nodes outside of the abdomen.
Treatment involves surgery known as a laparotomy, which is the removal of ovaries, fallopian tubes, uterus, and some lymph glands around the area. The tissues removed from the surgery are then taken to the lab and tests are performed to identify more information and confirm the stage of cancer. Side effects of the surgery include surgically induced menopause in patients that were getting their periods beforehand. The surgery also results in infertility.
Chemotherapy treats the body with anti-cancer drugs. Side effects include fatigue, hair loss, and risk of infections. Radiation therapy is mostly for palliative treatment. External beam radiation is given externally, whereas brachytherapy is given internally. Side effects are irritation, weakened bones, and lymphedema.
Ovarian cancer patients often seek treatment for sexual dysfunction. This is best managed in a multimodal approach whereby the physical symptoms are treated with medication and hormone therapy by a gynecologist. Psychological intervention may be helpful to manage psychosocial symptoms, and physical therapy such as stretching and pelvic floor exercises have also been beneficial in the management of sexual dysfunction.
5-year survival rates are graded according to the International Federation of Gynecology and Obstetrics system. FIGO Stage 1 has a 92.3% 5-year survival rate, Stage 2 has a 71.7 5-year survival rate, while Stage 3 has a 27.4 5-year survival rate.